How common is postnatal depression and why does it occur and who's most at risk?
So that's probably one of the biggest questions. So it's extremely common. I think a lot of women have tendencies towards it as well. Depends which lens we want to take. All right, so let's take the nutritional lens to start. So if we look at postnatal depression, it's much more likely in women who are anemic during their pregnancy, and all women lose an enormous amount of iron during their pregnancy. It's just normal phenomena. They expand their blood volume to encompass the baby, so it's hemodilution, and as everything gets more dilute, they lose more and more iron. Normal. So if they're anemic, they can't think as well. But zinc and copper does this beautiful dance when a woman is pregnant. And zinc eventually gets fairly concentrated in the placenta, copper gets very concentrated in the brain. And if that dynamic happens in a really, productive manner, then the initiation of the labor process happens. The copper tells all the brain signaling, the zinc tells the placental signaling, baby comes out, everything goes back to normal. But if she goes through a pregnancy and the copper stays high in her brain, or she doesn't have enough zinc during the pregnancy, then she leaves the pregnancy with too much copper in the brain, and then her risk of postnatal depression is increased. Like it's almost guaranteed for patients when I see them. I'm not even going to put a number to it. Other variables around postnatal depression, though, are obviously trauma in labour, trauma during the pregnancy, anything along those lines. But I do think that, let's say we take a normal pregnancy, a normal labour, and the woman goes through the experience, postnatal depression is more likely if she has a traumatic experience because she's unable to surrender to the process of the labour. So if her choices are taken away from her, it doesn't have to be like really controversial labour or really, medically traumatic per se, but just if her choices are taken away from her and she's unable to have full, what's the word I'm trying to think of? She has full capacity to have the type of birth that she wants, she often dissociates. And I do think that just the birthing of our children, certainly our firstborns, I always liken it to a shattering, like I always describe it that way to patients, where it's our first children shatter us. They shatter our egos to enable us to move to that space of service for them. And postnatal depression tends to come up when either we fight the shattering or the shattering is too brutal and we're not ready for it. And so if we're not ready for that adjustment of the extreme load of having a child, it's absolute pure service. So there's lots of other variables that go with it, but it's very much around making sure that the brain changes are nutritionally optimized so that she's prevented from having those sorts of slides, and then given the emotional support that she needs around the experience.